about cervical cancer. And sometimes it is bleeding after sex or after intercourse, sometimes unusual discharge, watery discharge sometimes. And all this could be pointing towards cervical cancer signs. These may be early signs of cervical cancer, as I've said: bleeding, PV discharge, which is sometimes watery, you know, a cancer which is always caused by an infection we call HPV, or human papilloma virus. And it's a virus that we said sometimes it comes as a result of engaging with multiple partners, or even one partner sometimes, because most of the men are carriers of the HPV virus, or the human papilloma virus, which is responsible for causing this cancer. And so we want to understand which are these signs. So everyone joining me live right now, I would want you to be very steady now as we look into this giant cancer called cervical cancer. And one of the most common cancers in women is cervical cancer, affecting most of the largest population of women in Africa, and many other continents. And many women, they really do not understand, they really do not know the signs. And sometimes this disease can progress silently. And the good news is when we detect it early enough, it is very possible to treat it. It's very possible to eradicate cervical cancer. Very successful. But if it is detected very late, it is very unsuccessful to treat. Most of them go to up to stage 3, stage 1. It's difficult to treat. We said it is caused by persistent infection with human papilloma virus. It is a virus which is found mostly carried by men, and most of our women get it after they start reproductive life. And so today, blessed viewers, when we seek medical help, it is very possible. If you seek medical help early, it's possible to prevent cervical cancer. And the early signs, or the early warning signs, includes one of the following things that I'm going to discuss. Sometimes you get PV bleeding, abnormal PV bleeding, especially between menses, bleeding that does not go away. And I'm saying that's why screening is important, because sometimes you never understand, because sometimes abnormal bleeding could be due to hormonal changes, hormonal imbalance. And so it's not every bleeding that will be termed as cervical cancer. But sometimes these things bring a warning to us. And as we progress, we can understand that most of the commonest signs of cervical cancer include abnormal vaginal bleeding. Let me just give you a hint that this is one of the commonest warning, as a sign to watch out. If you have abnormal vaginal bleeding, bleeding between periods, sometimes this is the commonest warning sign. Or bleeding after sexual intercourse with your partner, or bleeding after menopause. People who are past menopause and they are bleeding, or menstrual periods that become heavier. Understand? Periods that become heavier. Usually, any abnormal PV bleeding should be checked. It's not always that any vaginal bleeding is cancer, but it should be checked by a doctor. And unusual vaginal discharge is another sign, very common and very alarming sometimes. Abnormal vaginal discharge. Sometimes this discharge could be watery, thick, foul smelling, and sometimes, mixed with blood, and you're like, oh, what is happening to me? I thought this is a UTI, a candidiasis, but this one is mixed with blood. Sometimes it can be tissue breaking down if it is very thick and bringing out debris, and blood. So sometimes people get pelvic pain as sign number 3. Women may experience pelvic pain around the lower belly, persistent pelvic pain, especially that is triggered during sexual intercourse, could be a sign of cervical cancer. And this pain should not be ignored, because if it keeps recurring, it could be a sign of cancer. Pain during urination is the fourth sign, or bowel movement, or defecating when you're going to relieve your bowels and going to the toilet. If you have pain during defecation or something like that, that could be another sign that you could be having that cervical cancer, pain during bowel movement and during urination. And the fourth sign in advanced symptoms in the cancer now is progressing. Sometimes you could get now these real signs, which includes lower back pain, a lower back pain that hurts, swelling of the legs, extreme fatigue, unachoka sana, unexplained weight loss, you're losing weight abnormally, you need to be checked. And at this stage, mostly the disease may have started, when you start swelling the legs and the like, pain at the pelvic region, sometimes even spreading to nearest body parts, So risk factors for this cervical cancer, blessed viewers, are the first and the greatest is HPV virus. So early sexual intercourse is a risk factor because the more you get exposure earlier, multiple sexual partners, this is a higher risk because you get more exposure to HPV, weak immune system. If you have a weak immunity, like in compromised condition, not screening early. If you don't do screenings of your cervix early enough, that could be another risk. Prevention and screening is very important. So the good news, blessed viewers, is that cancer or cervical cancer, this cancer is totally preventable. And that's why WHO says no woman should die of cervical cancer because it's totally preventable. And these methods of preventing includes there's a HPV vaccine given regularly, screening regularly, giving HPV vaccine, especially to age, I think in most countries it is 13 and below. They're given a HPV vaccine, and some of the tests that we do are a pap smear can be done. You can be done another test called via villi. There are many methods of screening, and they are not painful. They are not invasive. And I would want to pass this message to you today that today, whatever I've taught you is very simple. If you are a woman and all women in your family, you have women in your family, mother, sister, a sibling, a wife, could be a wife to somebody, daughter, encourage them to do cervical cancer screening as early as possible. Mostly it begins between age 25 to 30, depending on the guidelines of every nation. Especially if a woman is sexually active, If you notice abnormal bleeding, unusual discharge, vaginal discharge, or persistent pelvic pain, please, you should visit a healthcare provider or a health facility. Understand? So thank you so much for joining, and I would want to give you another brief I would want us to brainstorm anyway, and you may write these questions and comment on the comments, answers on the comments, blessed viewers. And I want to ask you a question. Have you ever had one of the following signs that we have talked about? Or can cervical cancer happen without symptoms? I want you to answer me. And it is true. It can happen without a symptom. So that's why the need to screen, even without any of these symptoms, you need to go and do screening. Actually, screening is very important because we don't want to find you with the cancer, We want to find you normal. And if there is any sign that we notice, we treat you, which is the main cause of cervical cancer. We said it is, you can answer me in the comment, but it is the persistent infection with HPV virus. Especially if your body is not able to eradicate it through immunity, you get that. So does bleeding after sex mean cervical cancer? It could, but not always. So it needs to be checked, because it can also be caused by other infections. Vaginal bleeding can be caused by infections, cervical inflammation, but it should always be checked. Don't assume. So we're saying HPV is the main cause. And at what age should women be screened? Can you be able to answer me at the comment section? So we are saying women should be screened between age 25, 30 and above, 25, 30 and above, until age, and above. Every woman who is above 25 should be screened, but depends on your guidelines of the nation that you come from, because different nations have different guidelines. Some begin at, can cervical cancer be prevented? Yes, this is where we take our message home, because there is HPV vaccination, regular screening, safe sexual practices, And maybe the last question should be, is cervical cancer treatable? Yes, if it is detected early. If we do a viability, we see some lesions that are starting to grow into cells that could be cancerous, we treat them, And can men transmit HPV? This HPV, yes, men are mostly the carriers of the HPV. Even they don't have symptoms, they transmit and they don't have symptoms for HPV, So men can transmit HPV. Does having one sexual partner eliminate the risk? Yes, the risk will be low, because this person might not have the HPV compared to seeing many people. But if this person has many partners or had met many partners before you, then the risk could be as well as higher, even if it is just one partner. So we are going to talk about what screening methods now are commonly used. What screening methods are commonly used to treat, to diagnose cervical cancer. We have a pap smear, papillomacosis smear. We have HPV testing, direct testing of HPV virus, a via villi, which is done with CETIC. And the last question may be, how often should women usually be screened? That should be between 3 to 5 years, depending on the test used and their immunity and the national guidelines. Mostly, if the immunity is low, yearly. If they have good immunity, 3 to 5 years. 3 to 5 years, you screen every 3 to 5 years, depending on the guidelines of your country. So, cutting short, cervical cancer is one of the most preventable cancers. So, no woman should die of cervical cancer. Yet, many women die because they are diagnosed late. They come for diagnosis very late. You understand? So, if you're watching this live, kindly encourage a mother, a sister, a wife, a friend to go for screening. Early screening will improve the treatment of cervical cancer, and mostly every person who has been screened early, they get to be treated as early as possible. So cervical cancer is preventable, it is screenable, it is not painful to screen, and it is treatable. And mostly it is treatable freely in our government facilities if detected early. So if you are a woman above 25 years, please go for cervical cancer screening as early as possible. Don't wait for these signs, And if this information helped you, kindly help me to like, share, subscribe to this channel so that you can be getting more updates. Next time we're going to do another live also to discuss about how we treat it now, So talk about it, reach many people, let us improve our health. Be blessed. Thank you very much. See you in the next video. Thank you.